Thank you very much for your time. My name is State Senator Tony Hwang, and I am here to testify on behalf and support of SB 252. A summary of that is to increase reporting and transparency of hospital infection rates. I think as I begin in this, I've already submitted testimony, but let me go through that. I think that the impetus for this is that in December of last year, about half of Connecticut hospitals were penalized by Medicare for their high rate of hospital-acquired infections and conditions. And I think we have all experienced and heard stories in regards to infection rate. Let me begin this testimony by saying that I want to thank and send my appreciations to our Connecticut hospitals for the great work that they do in providing care as well as charitable care in our communities. And I am very, very open in working with our hospitals as well as with our Department of Public Health in discussing this issue in regards to working out processes and plans that are more transparent, more accountable to the consumer. I believe one of the things you'll see and read in following up testimony is the fact that we have an existing plan in place. And that is no small credit to the work of former Senator John McKinney in proposing a bill and asking for that reporting. But I am asking for this committee to review the process and possibly moving it a little bit further. I think the continuation of this work is critical for the simple reason that as a consumer that is going into a hospital and providing and getting inpatient care, we truly do not know what the hospital's infection rates are. I grant that there's an annual report to the Department of Public Health, and that is available to governmental bodies. But in a cursory online search with 3 hospitals, I was looking at their hospital infection rate reports, and as a consumer, I could get no such information. And that is one of the concerns that I have, that we are not taking this data, as you will hear, is readily available for the good work of data collection of our hospitals throughout our state. But that information is not readily available to the consumers. The very individuals that are going to be impacted by having a consumer choice of what facilities and the level of care that they need to get, and they want to get. So I am asking for this committee to review this, and I appreciate the chairs and the leadership of this committee to raise this as a subject matter. But the emphasis should really be, is that information, as we have said, is readily available, need to be made in a conduit and made available to the consumers. It's as simple as transparency and accountability. I think one of the things we can look at is what the state of New York has done in their statutory requirement and reporting. And I don't have the specific data, but I'd be happy to provide this committee. But the fact that when increased transparency and disclosure occurred in the state of New York, infection rate violations decreased. Aren't we all working on the same mission? I would submit to you that I am, again, committed to working with our Department of Public Health, working closely with our hospital associations to try to formulate a plan in which we are able, in this day and age of readily available information to our consumers. There is nowhere that I can find that a consumer going into a hospital for an inpatient procedure is able to get this infection rate report. And I think, as we have heard countless stories, infection rates are going rampant with superbugs and infection rates. We have patients that are going into hospitals and being infected by other infections that are unrelated to their care. And I know we have some healthcare advocates and physicians on the committee. I would welcome that kind of exchange and ideas how we can make it better. And I bring up a personal effect. You know, my father passed 4 years ago, and he went in for one bit of surgery of getting a biopsy done, and 3 days later caught an infection. Unbeknownst, an infection that proceeded, combined with his illness and cancer, impacted his well-being. My hope and my prayer is the fact that we do a better job in letting consumers know and putting the onus on our healthcare deliverers to give the best product out there for the people that we care and love. So I'd be happy to take any questions, but I implore this committee to explore this issue and create a workable situation of transparency and accountability to the consumers. Thank you.
Senator, thank you as always for being here. I know my co-chair has a question.
Thank you. Thank you, Senator, for coming and testifying before our committee on this issue. I know I worked on it last year with Senator McKinney also to add in additional language that would make the process a little more transparent. What I need to get a handle on, because I read the Connecticut Hospital Association's testimony as well as the Department of Public Health, and you should read it also. It's online, with the bill, is what do we need to do to make it more transparent? The Hospital Association says they already report 82 different diseases and infections and so forth to the department. The department is saying we gather this data, we have far more information now than we've ever had. So what I need for you and I to do is just work together how you see language, I guess, or what more do we need to do. And I would also ask that you work with CHA and also the department to see what we can do. If we need to fine-tune this in some way or expand it, I would appreciate that work on your behalf. So thank you for coming before our committee, and I do appreciate that fact.
Madam Chairman, I appreciate you raising that point, and I actually did indeed read the testimony from CHA and our DPH department. And I understand that, and I understand that we have to have a balance between burdensome bureaucracy and over-reporting that moves away from the care. That I respect that, and as I caveated earlier, I am absolutely open and committed to working with our DPH, the good work of Dr. Mullins, and all of our hospitals, because I greatly appreciate the tremendous work that they do in our community. Not only in healthcare delivery, but in regards to the charitable work, they are an essential part of our community. I'm not looking to hurt them. I really am not. But what I also want to ask this body to consider is, from a standpoint of reporting and transparency, I bring up an example, and I don't know if it's a good parallel. Our hospitals do some great work. And when you hear of the great work that they have done in healthcare delivery, whether it is tertiary care or cardiac care that ranks it high in the country, that data is readily available as a marketing tool on their websites. That data point is readily searchable by a consumer who's making that choice between what facilities they want to go to for a particular area of care. That's transparency. That's putting out the news to say we're better than the other. But I don't have that type of a premise in regards to letting people know what our infection rates are in various institutions. I can't find that out as a consumer in making a choice of where I can go to ensure that the hospitals are doing all that they can to ensure that the infection rates and all protocols in place are there. So I offer that as an example of saying, if we readily want to purport good news, why do we not put the incentive, the real onerous, to say, if there is a potential that you have issues in regards to potentially high infection rate, when you have over half of our hospitals in our state being cited by Medicare for excessively high infection rates, it's a concern. It's a concern. But more importantly, I have to get that report from a Kaiser Foundation or DPH report. I, as a consumer who have loved ones that are going into hospital for procedures and care, am not able to access that readily. And I would welcome that. I really would. Thank you.
Thank you, and thank you for your clarity. Are there any questions?